Across Kenya and beyond, the National Cancer Institute of Kenya continues to lead the country's response to cancer through strategic leadership, partnerships, research, capacity building, and community engagement. Working alongside the Ministry of Health, county governments, healthcare institutions, development partners, and communities, the Institute continues to transform Kenya's cancer response, strengthening policies, expanding access to services, investing in research, building partnerships, and bringing hope closer to every Kenyan. This is the story of leadership, collaboration, and impact.
When you're given a position in leadership, every decision you make, you must remember there's a human being on that other end who is being affected by those decisions.
At the national level, NCIK continues to provide technical leadership in implementing Kenya's national cancer control strategy. Through policy dialogues, stakeholder consultations, and advisory meetings, the Institute coordinates national efforts aimed at reducing the burden of cancer while improving access to quality prevention, diagnosis, treatment, and palliative care.
As a government, we are fully committed to strengthening cancer prevention, screening, and early diagnosis. We are expanding treatment services across all our regions in our country. We are investing in our healthcare workforce, and we are integrating cancer care within our universal health coverage agenda.
This event is therefore a true milestone in our national healthcare journey, because we are here to launch a center which represents the convergence of high standards of treatment, state-of-the-art technology, affordability, and effectiveness in cancer treatment. Kenyatta University Teaching, Research, and Referral Hospital will deploy an advanced robotic radiation treatment machine known as the CyberKnife, which introduces revolutionary capabilities and enhanced efficacy in cancer treatment by locating, tracking, and accessing tumors that are ordinarily difficult to reach with precision. Again, I agree. Now we will move to CyberKnife precision. The technology is therefore able to administer more radiation with great precision, meaning that fewer sessions, maybe 4 to 5 only, instead of 20 to 30, are required, with each session lasting only between 5 and 15 minutes. This will significantly improve treatment outcomes and be able to deliver these services better, affordably, and much more effectively. Cumulatively, these advantages lead to shorter recovery period, minimal side effects, and better overall outcomes. The government therefore intends to sustain its investment and support for highly advanced diagnostic and treatment equipment to actualize the highest standard of treatment and care for all people. The CyberKnife technology at this hospital is the second in our continent, the only other being in Egypt. This propels Kenya to the frontier of advanced medical technologies and catalyzes our strategy to quickly emerge as an advanced regional and international medical hub. Its location is in a public hospital sends a strong signal to all Kenyans that it is no longer necessary to travel far away for advanced treatment that are now available, accessible, and affordable in our public hospitals.
We therefore encourage Kenyans to utilize our diagnostic and treatment services within the country. There isn't much need to travel abroad now for treatment as it has been before. We have the latest of equipment, including CyberKnife, including PET scan for diagnosis, including surgical treatments that are so minimally invasive and treats cancer, laparoscopic surgeries, which our fellow homegrown trained and also international trained healthcare workers are able to deliver right here back at home through our centers of excellence within our regions and the national hospitals that our country has established.
Throughout the years, NCIK has worked closely with successive cabinet secretaries for health, parliament, county governments and other public institutions.
Cancer remains a major public health challenge globally. In Kenya, it's among the leading causes of morbidity and mortality, placing a heavy burden on our individual families and communities, and above all, our health system. For many years, access to radiotherapy services has been limited and has been centralized, with many patients forced to travel long distance, often to Nairobi, to receive treatment. This has resulted in long waiting times, as well as substantial financial and emotional strain. These barriers have resulted in delays in accessing care, increased treatment costs, and tragically poor health outcomes. But today we stand at a turning point. We begin to change that narrative. The commissioning of the Mombasa Radiotherapy Center marks a bold step towards equity in cancer care. It represents our commitment as a government to ensure that no Kenyan is denied life-saving treatment because of where they live.
Saratani inaendelea kuwa tishio kubwa nchini Kenya, huku takwimu za taasisi ya kitaifa ya saratani zikirekodi wastani wa wagonjwa wapya 125 na vifo 80 vinavyotokana na ugonjwa huo kila siku.
I'd like to compare with if an accident occurred today and 80 people died in one day, the entire country will sit and discuss how do we address this. And every day, 120 people being diagnosed with cancer. You know, that is a big number. And
takwimu hizo ziliwekwa wazi wakati kamati ya afya ya bunge la taifa ilipofanya ukaguzi utekelezaji wa bajeti katika taasisi ya kitaifa ya saratani nchini. Ni hapa ambapo afisa mkuu mtendaji wa taasisi hiyo, Daktari Elias Meli, aliwaelezea wabunge kuhusu changamoto zinazokithiri humo nchini, ikiwemo uhaba wa vifaa muhimu, hali inayowanyima wagonjwa wengi nafasi ya kugunduliwa mapema.
We may not be able to get 100% what is our burden, but if we are able to get at least our burden, you know, that represents more than 85%, because even the US do not have data 100% of their burden, but at least anything above 85 would be sufficient.
Ili kuimarisha mapambano dhidi ya saratani, taasisi ya kitaifa ya saratani imeomba kutengewa shilingi bilioni 4 kwa minajili ya kupanua huduma za uchunguzi, kuboresha utambuzi wa mapema, kuimarisha matibabu na kuongeza idadi ya wataalamu wa saratani.
But what has come out very clearly is actually we need to fund them more, because the last 3-4 years we have funded them. When they started at very low.
Wabunge sasa wanatoa wito kwa serikali kuongeza uwekezaji katika huduma za saratani, wakisema hatua za haraka zinahitajika ili kudhibiti mzigo unaongezeka ugonjwa huo ambao umeendelea sasa kwa miongoni mwa visababishi vikuu vya vifo nchini.
Recognizing that cancer control requires collective action, NCIK has forged partnerships with local and international institutions to strengthen Kenya's cancer ecosystem through research, innovation, technology transfer, and capacity building.
Recently, the Ministry of Health signed an MOU with Roche Pharmaceuticals to enable our patients access one major game-changing, life-transforming, life-saving drug called trastuzumab. The specific name for the company is called Herceptin. This drug is used to treat patients who have breast cancer. And previously, this drug costed 300,000. The cost over time reduced to 150, 120. And at the time when Ministry of Health signed an MOU with Roche, the drug was costing 120,000. And thanks to the partnerships through access programs, this drug now costs 40,000 shillings for our patients. Our patients require at least 18 cycles. And under the oncology benefits package under SHA, these patients can now afford this drug without adding even one extra shilling. We really want to appreciate the partnership between Roche and Ministry of Health that has enabled our patients to access this treatment.
The IEA has gone beyond its traditional role of becoming a hope for cancer patients, not only in Kenya but across the developing world. You have supported us in expanding radiotherapy infrastructure, bringing treatment closer to the people. The IAEA has supported the procurement of modern radiotherapy equipment, including the linear accelerating machine for such centers like Nakuru and Mombasa. These machines are critical because about 50% of our cancer patients require radiotherapy as part of their treatment. As a result, Kenya is moving from a high centralized system, mainly based in Nairobi, to other regional cancer treatment hubs. As the PS said, we are now opening up the country. We are opening soon at Jaramogi. We are opening one in Kisii, building one in Nyeri, in Meru, and in all our referral hospitals across the country. You have supported cancer diagnosis. IEA support goes beyond machines. It has strengthened the entire cancer ecosystem, from providing the diagnostic imaging equipment to nuclear medicine support and the treatment planning system.
Together, we aspire, working with partners locally, regionally, and internationally, both public and private sector, including faith-based advocates, academic institutions. We are putting together a collaborative movement that will ensure that across the entire continuum of care of cancer, there is always quality. And we embrace the current leadership of Kenya Kwanza that has extremely seen the need of launching universal health coverage. The Kenya Kwanza Health Manifesto clearly is pro-community health strategies in handling health-related issues. Primary health care is a cornerstone of our work at the National Cancer Institute of Kenya, because cancer can be prevented, and if it cannot, it can be screened towards early diagnosis. And at the same time, if unfortunately it's diagnosed when it is fairly advanced, then we should be able to provide treatment with curative intention or palliative intention. And NCI is strategically positioned to coordinate, to guide, and to lead both national government and county governments in ensuring that cancer is treated with curative intention where possible. And where not, we should be able to provide quality of life.
Kenya's experience in cancer prevention and control continues to gain international recognition.
We are strengthening our cancer care by equipping our national and county referral hospitals with essential screening and treatment equipment. Mammograms have already been installed in Kisumu and Kerugoya, while CT scans are operational in 15 county referral hospitals, with installation underway in another 15 additional counties. Data is our compass. Our National Cancer Surveillance Platform is enabling real-time data to drive smarter, targeted decision-making. On prevention, the ministry has successfully integrated the HPV vaccine into our routine immunization schedule, targeting adolescent girls aged between 9 and 14 years. This is a momentum step towards the elimination of cervical cancer. We are expanding our community-based screening for breast, cervical, prostate, among other cancers, through community health promoters and mobile outreach teams. Early detection saves lives. We are also strengthening our referral system to ensure timely follow-up and care. No Kenyan should suffer or die because of delayed treatment.
NCIK has represented the country in global conferences, scientific forums, and bilateral engagements in France, Switzerland, the United Kingdom, Australia, the USA, and many other countries.
It is a profound honor and privilege to stand before you today on behalf of the National Cancer Institute of Kenya, the Ministry of Health, Kenya, and the Government of the Republic of Kenya as we officially receive this hosting opportunity right to host the World Cancer Leaders Summit 2027. We are especially honored because Kenya is receiving this opportunity after a highly competitive global bidding process. The confidence that UICC has placed in our nation affirms Kenya's growing leadership in global health and unwavering commitment in reducing the cancer burden. We extend our heartfelt gratitude to UICC for this, and we look forward to co-hosting this event with EOTIC in Kenya, with KESHO, that is Kenya Society for Hematology and Oncology, KENCO, Kenyatta University Teaching, Research and Referral Hospital, Kenya Medical Research Institute, Kenyatta International Convention Center, where that will be the host convention, a beautiful facility. And we look forward to partner with WHO, of course, UICC being the host of this, and IAC and IAEA. We appreciate the confidence you have placed in our nation, our institutions, our commitment to advancing cancer prevention and control across the continent and the world. This is not just a vote of confidence in Kenya, but Africa's growing leadership in shaping global health priorities.
Participation in the IAC 60th Anniversary Conference in Lyon, the Commonwealth Health Coordination Forum in Geneva, and engagements with Guy's Hospital Cancer Centre and King's College London have strengthened collaboration in research, specialist training, cancer surveillance, and infrastructure development. The Institute has also strengthened the National Cancer Registry, supported research governance through ethical review processes, and embraced digital innovations that improve cancer surveillance, planning, and patient care.
And again, we are launching a very important committee on scientific and ethics review. And that is so important because for us to make, as government and leadership, to make even the board and us at the Ministry of Health, to make the right policy decisions, we must get the right data, scientifically proven with evidence, so that we don't do guesswork. Because at the end of the day, as the chairman said, every decision we make within the healthcare sector affects the patient. So the decision must be made right, it must be evidence-based, and it must be done timely.
NCIK has supported the establishment and strengthening of regional cancer centers across Kenya, contributed to the expansion of radiotherapy services, promoted access to modern cancer technologies, and supported healthcare institutions in improving cancer diagnosis and treatment.
Thank you very much. We are here from the Ministry of Health under the leadership of our Cabinet Secretary to increase the capacity for our county governments in provision of cancer care across the entire continuum of care. And we are happy that today we are here at Samburu County Referral Hospital for this very important activity where we have launched a cancer treatment center here. And it is not just about the launch, it is actually beginning with actual treatment. Today we have been able to treat 4 patients who have received treatment, and we've all witnessed, with prostate cancer and other different types of cancers on day 1. We are also happy to report that Samburu County Referral Hospital has a fully trained, qualified oncologist who is going to lead in the efforts of providing these services here in the county. It is an initiative by the Ministry of Health through the National Cancer Institute of Kenya to make sure cancer services are devolved to our different counties, and we've done this in many other counties. We are happy that Kenyans should not be traveling far away from their homes to seek treatments, and these are very expensive treatments. Sometimes patients struggle to even get transport to get to Nairobi, Eldoret, or Nakuru, where there are comprehensive cancer treatment centers. So this is quite a reprieve for the people of Samburu County and its environs, because they'll get treatment close home.
We are here at the Lodwar County Referral Hospital to launch a clinic or a center for the treatment and diagnosis of cancer cases here in Turkana County. I think this is the first time we are launching it. It has really been an issue of people traveling from here, or referring people from here, or referring them from here to Eldoret or other places in Kenya or even outside Kenya.
Your Excellency, our Governor of Turkana County, we are privileged from the National Cancer Institute of Kenya, Ministry of Health, to have had an opportunity to celebrate World Cancer Day here in Lodwar, Turkana County, and part of our initiatives towards reducing the burden of cancer in our country is to increase access to treatment and diagnosis and treatment of cancer for our patients. The National Cancer Institute of Kenya is the implementing agency, on behalf of Ministry of Health on cancer agenda. we have a huge burden in our country, and our country's population is increasing, and we are now appreciating how coordination between the national government and the county government through these efforts here today in launching this cancer unit at Lodwar County Referral Hospital. We are happy that the patients will not have to travel very far, they will not have to incur the cost, and they will get treatment right here close home, and by evening they should go back home. Your Excellency, we are happy we are making commitment, while our first patients today have actually received treatment here. So we did not come with promises that we will come and set up a center, but we have come walking the talk, and this is because of the able leadership in the ministry and the institute to make sure when we visit, we shall leave a mark.
Yeah.
The commissioning of the Mombasa Radiotherapy Center marks a bold step towards equity in cancer care. It represents our commitment as a government to ensure that no Kenyan is denied life-saving treatment because of where they live.
Through these initiatives, specialized cancer care continues to move closer to the people. NCIK has organized and supported numerous trainings, mentorship programs, workshops, and technical exchanges for healthcare workers across the country. Beyond boardrooms and conference halls lies the heart of NCIK's work, the people. The institute has traveled across Kenya, bringing life-saving cancer services to communities in Turkana, Samburu, Kwale, Nakuru, Uasin Gishu, and many other counties. Working hand in hand with county governments, healthcare workers, and local leaders, the institute has ensured that quality cancer services reach populations that would otherwise face significant barriers to care.
Cancer today is the third leading cause of death in the country. As we speak right now, we have an average of about 47,000 new cases on an annual basis. The death rate caused by cancer has surpassed from what was 27,000 to now up to 32,000 deaths annually. And cancer does not pick one's tribe, it does not pick one's gender, it does not pick one's age. And more so, cancer does not pick what someone's capacity or capability of what their pocket can be able to give them. Cancer is a scourge that is here, and we are here proudly to be able to save lives of those who need, be there for support to those who need our support as leaders, as government. Previously, we would have a situation where people would have to travel from Mombasa, by the way, from different parts of this country, and they'd have to travel all over the world. India was a preferred destination, South Africa was another preferred destination, and today someone just has to leave their home and be able to get that treatment right here where we are.
But today marks a significant milestone in our fight against cancer. With the support of the National Cancer Institute, I am excited to announce that plans are underway to establish cancer treatment services right here in Lodwar. This means that our people will no longer have to endure long journeys or face prolonged waiting times for life-saving treatment. This is a transformative step in ensuring that healthcare is brought closer to our people.
My name is Pauline Denguris, County MP for Samburu, and also a member of the Health Committee. Today I'm so delighted to host our CS here and the team from the National Cancer Institute Center for coming to see what we are doing here in Samburu in terms of health provision to our people. Thank the National Cancer Institute Center really for enabling Samburu County to start treatment today. This was our first day that we started offering the cancer treatment to our patients. We have been so much affected for our patients being transferred to Nakuru, sometimes going to Nairobi, and due to congestion they take a lot of time before they are initiated on treatment. But today we are happy because from today on henceforth our patients will be accessing treatment here. So they will not be traveling, they will get all that they will require in terms of cancer treatment here.
Across hundreds of outreach programs, thousands of Kenyans have received free screening for breast, cervical, prostate and HPV vaccination services. These outreach activities have enabled early diagnosis, timely referrals, and increased awareness of the importance of routine cancer screening.
Wamekuta kabisa wanaume, maana walikuwa wanasikia uoga. Wengi hata wale tumesema na hao wananiambia hawatakaki kwenda kule sana, maana wanasikia uoga, aibu. Lakini sasa tumeona sasa kipimo hiyo ndio mzuri. Hata watu wengi wanafutiwa na hiyo kipimo. Kwa hivyo sina mengi.
Across schools, markets, churches, workplaces, media platforms and community gatherings, NCIK has empowered Kenyans with accurate information on cancer prevention and control.